Hey, good morning, everybody. It's Mike again. This morning, I've got Rhonda Helton from Healthcare Solutions team. And a lot of you who buy businesses are either transitioning from the corporate world in which there was a healthcare plan provided by a company, or you're coming in from Europe. So a lot of you coming in from Europe on immigration visas, when you're buying companies, one of the things I've always been asked is, how do we deal with healthcare? And what I end up doing is pointing you in the direction of people like Rhonda. So Rhonda, I'd like to introduce yourself, give a quick history of what you do in the company, and then we'll talk some case specifics about the businesses we kind of deal with, those Main Street businesses. So I'm going to let you kind of roll with it.
Well, good morning. My name is Rhonda Helton. And my tagline is "Help me, Rhonda." In my business group, I'm a broker agent with access to multiple carriers, whether it's for one individual, whether it's a family, a group, an employer setting. It's quite a big to choose from. I give them a customized, like a concierge type service. I'm not a vending machine, buy one plan is good for everybody. I've been doing this for many years. I have a background of a retired nurse. I was highly specialized, high-tech kids, the COVID stuff that's going on around right now. I'm very familiar with transmission of this and transmission of that. I'm grateful now I'm not as exposed to that type of background. I can work with people over the phone. I can work with people with a Zoom meeting, or so it doesn't matter whether you're here in Florida or you're in another, state or globally. But I feel very blessed that I can work with people, get to know them, connect, find out what you want for your budget, for your family, for your employees, whether it's one person, two or more. I'm there to help people. If I can't help you, I'm real quick to let you know that. I'm not going to waste your time, and I'm certainly not going to waste your hard-earned money.
Okay. Perfect. So let's talk about, what we deal a lot with at Transworld, which is, like right now, there's a bunch of people who've just been laid off, and they're starting to call me, and they're wanting to buy businesses, to replace income. And everyone needs to understand, as they're listening to this, your cases are going to be, unique. But on the top line, Ron and I kind of figured out some generalizations. So, the average business that gets purchased in Central Florida is for $300,000 or under. So what I call those is basically people are buying jobs. And for the sake of our modeling this morning, Rhonda and I decided we were going to use a carpet cleaning company with 3 employees as a model, doing $250,000 to $300,000 a year in revenue. And I wanted Rhonda to kind of take you through the various options, both for Americans, and then if you work with me at all, a large part of my practice is immigration related, particularly from England or some of the other, nationalized healthcare systems where you have healthcare, and then you're coming here and you're scared to death about, how am I going to take care of myself and my family if something goes wrong or I get sick. So let's do the Americans first, Rhonda. Like, what are the options for an American at that level for that Main Street business?
Well, I get on the phone with the employer, and we're talking about employers now, right?
Well, we're talking about a guy who buys a company, a guy or gal who
Okay.
buys a company. So they've bought the business. They're the owners of the business, and they want to give health care to themselves, their families, and offer it to their employees.
Okay. If husband and wife, I would with just them, one or more employees, I can put them on a group plan. Sometimes that does save them. They're able to do a pre-tax benefits. And there's a lot of things in the tax codes about that. I'm not a tax expert, but I'm able to customize it. So how much does the employer want to contribute? Or do they want to have the employee pay for it all?
Well,
so in that case, I might combine major medical, limited medical, and with a supplemental to cover for those catastrophic or unexpected things.
Right. So, the bottom line is like there's like this menu that's going to be available for that person who bought that company of what things are going to cover, at what level they want the employee to contribute to the plan, or if they want to pay for it all because they're just really, really gracious people, they can do that. And then based upon what they pick off the menu board and some other factors related to them personally, age, health, et cetera, pre-existing conditions, et cetera, that'll move the deductible on a monthly basis up and down, right?
Yes. I always find out how much does the employer want to contribute, or if they just want the employee to pay. And then I go based on what their income is, because there's no reason for me to put somebody in a plan they're paying $800 a month for something when they don't have that kind of budget.
Right.
So I would put them in a.
Yeah. So the buyers out there, if you're watching this, what's going to happen is you're going to look at me and you're going to go, hey, I'm buying this business. It produces this much in free cash flow. So in that free cash flow, this is more for them, Rhonda, than it is for you. But in that free cash flow are these benefits. And then these benefits that Rhonda's talking about, you got to pay for. So how much do you want to make, Mr. Owner? And how much do you want to put as a benefit dedicated to healthcare? It's something you kind of weigh out based upon the various different circumstances you as an individual face, and then the size of your family and the needs. So say you've got kids who have glasses. Say you're coming in from, your kids all wear glasses. You're going to need to pick a plan that has optical in it, right? For example, or you're planning on having kids. You're going to have, pre-baby, post-op, OBGYN. There's a whole bunch of extra visits that go related to women's health, and then post the birth of the child. You got to have all that stuff factored in as you're making these decisions with healthcare. For the Europeans that are going to be watching this, they just go to NHS and NHS pays for everything. Now their taxes are higher, right? But they don't have to make these choices. So it really confuses them about how they plan. So every year, business owners are talking to their providers like Rhonda to pick and plan what they're going to need. So it just requires a little bit of thought and a professional on the other side that can hey, it's not just a monetary decision. You got to make some life choices and understand where your family or you personally are, or your people are with regard to healthcare and how they're handling and what's important to them. Right?
Okay, so I would give somebody where they can go to the doctor, they're sick, they're injured, or they want a well visit. And then you might want to have a little bit of accident coverage. You cut your finger or you sprain yourself, you go into either the urgent care or the doctor's office. We add some vision and some dental. Dental's a big thing. Got to take care of those teeth. And in a group setting, it really does lower the out-of-pocket costs to the employee. The employer, depending on how they set it up, they actually have a tax incentive.
So you're going to work with their accountant and then to make sure they understand to apply that as a tax benefit, so it kind of offsets the investment they're making in their employee.
Yeah, there's even if they don't, let's say they don't have a tax person or payroll, there's a lot of software platforms out there that we help people to customize to fit that in, so that it helps the streamline it for their employees and themselves. The digital age has a lot of great advantages for the employer that's really, really busy, especially startups, that sort of thing.
Right. So it's part of their budgeting process. They really got to plan this. And although, when buyers, particularly the ones who don't have to do this in other countries, who want to buy companies, this is always in the back of their mind. They're always worrying about healthcare, and they've got this fear, like this overly expensive thing, but it's pretty manageable. You just have to know your numbers real well and have discussions with your family and your employees about, what's important, and then have good safety practices. You were mentioning like, going to the ER or going to the doc in the box, these pop-up emergency rooms we have now because someone gets cut. If you're in the trades, say you have a lawn service company, you've got like 5 people out there, there's a high likelihood they could get hurt. So you got to have all these safety procedures to manage this down. Now, one thing first-time business owners don't really think about is every time there's an accident, what happens to the insurance? It goes up, right? And every time you use the healthcare, it gets more and more expensive. So you have to kind of have a good healthy habits. Otherwise, you're going to pay a bigger number later, right?
Yeah, I mean, if you plan a great insurance supplemental plans that cover those accident plans, it keeps the employee from, a lot of times employees will wait till Monday to have a accident so they can put it on workman's comp. Well, that
Right.
drives the employer's cost up.
Yeah.
And we have phenomenal plans that people can use, and it's amazing how much it's really as expensive as people think it is. And it's like anything else. Just a little bit of education goes a long way, and it brings down people's concerns about the high pocket, the high cost. It's amazing. A lot of options nowadays, a lot of great products to lower the cost to not just an individual, a family, and the employer. So that should not be the fear. They're gonna, they got a lot on their plate getting their business going. Healthcare is not as complicated as what it seems to be.
Well, that's kind of the reason we want to do these videos with you and the accounting professionals and the lawyers, is to give them enough information that it kind of sheds some light on those dark spots, so they know it's not that fear of like, oh, this is some brutal cost and we can't afford to live our dreams as entrepreneurs because of healthcare. There's a lot of different options, available, and you just have to have someone you can talk to, right? Don't talk to your neighbor.
Yes.
You got to talk to somebody who's in the trenches, who does it every day, who, in your case, you're a nurse. You were trained as a nurse. So you've got some understanding of, some clinical understanding of what the circumstances are and what policies are really needed, as opposed to overkill, right? And like, don't go get a policy that's, needs X, Y, Z when you're 25, a million different things. And the best policy out there when you're 25, healthy, and you've never smoked or drank, right? And you're in a good physical position. Does that mean you shouldn't have coverage? Absolutely not. But, you have to weigh risk. That's why we have insurance programs, right?
I can pretty much find, if somebody really wants to have insurance protection, health, life, work-wise, I can find something for their budget. What you can always add more money, add more, products in there to beef it up, to enrich it. But bottom baseline, I can get them something that will cover them for a little bit, goes a long way. They don't need to be spending hundreds of dollars on stuff they're never going to likely use. And I do it all the time. I help people all the time.
Okay, well, that's awesome. It's really what I wanted to do with this video, is give somebody a face, a nice face to talk to, a point of contact. Rhonda, if you could give me phone number, website, email addresses, so when people finish up watching this, we can, they have some place to get you, and I'll put it into the notes on the video so people can access it and, call you if they need just a private conversation, because this is confidential stuff. This isn't stuff you kind of, take a cookie cutter approach. You got to get some personal information about them in order to help them find the right solution. So what's your
Yes.
contact info?
Rhonda Helton, it's RHelton at myhst.com. That's my email. My phone number is 407-230-6124.
That's awesome. I'll
They
put that
can
in
find
the
me
notes.
on
Facebook, all social media platforms. I'm going to put it onto the video notes, so I'm going to send it out and share it. And thanks for doing this. You don't know how much this is like the top of mind question for particularly the spouses. The ones who are taking care of the family the most are the ones who worry about this stuff, and they don't know who to turn to. So now hopefully we've answered some questions.
Well, Mike, I appreciate this opportunity and really do thank you. And if I can help a few families, then that's exactly what I'm here for.
That's awesome. You have a great weekend. Stay safe.
You too, Mike. Thank you. Bye-bye.
All right.